78 people with coronavirus or presumed to have it are being treated at Chattanooga hospitals. A point of information, health officials watch closely to determine if another shutdown is necessary. As Channel 3's Claudia Coco learned, now there is one more point of data they'll be watching closely.
Cindy, 27 of those 78 patients are Hamilton County residents. The rest of those patients are from out of town and being treated in Chattanooga. Now, the Joint Task Force is keeping a close eye on those numbers, and they're asking people before they even get tested to take a new survey that they've rolled out. Marked a new high in the number of COVID-19 patients being treated in Chattanooga hospitals, with 78 patients, 27 of them from Hamilton County and 15 in ICU. That's up from 49 total patients 1 month ago, when no Hamilton County residents were hospitalized for COVID-19.
Our broader region, which includes Chattanooga and I think Dalton, our broader region, there are 111 hospitalizations.
State officials put on hold plans to create an overflow treatment facility at the old Alstom site. A spokesperson for the state health department says there is no update on activating the plan, which county officials have said would take about 30 days to set up.
The state has a contract on that space if it's needed, and there are some other alternatives that are being looked at. So the county and the state are both working with the hospitals and monitoring all of those numbers.
As testing expands and cases rise, the Chattanooga-Hamilton County Joint Task Force is introducing another way to collect COVID-19 data. Patients with symptoms will now be asked to take an online survey before being tested.
So one of the things we're hoping this will do is reduce that lag for early detection for certain locations.
Tim Moreland developed the survey and says it will help identify hotspots where more testing is needed.
Also, potentially look at putting a new community testing site there to see if there really is something going on.
Good data hinges on people getting tested. Ray Bond says you should be tested quickly if you know you've been exposed.
Roughly within 5 days, you should be tested. It could take a couple of days for the virus to start to be present in your body enough to test positive.
If you decide to take the survey, there is an option not to share that information with the COVID-19 Joint Task Force. There is a link to that survey in my web story, so you can visit this story inside the WRCB app. For now, live from home, Claudia Coco, Channel 3 Eyewitness News.